Do you have a dog or another pet or even a horse who is going to have surgery or has had surgery recently? It could also be you, a friend, or a relative, and you're wanting to find good ways to help with pain and inflammation. This is Callie, my Australian Shepherd pup. She will be a year old in May, so we need to get her spayed. So she is in doggy jail right now. She can't be jumping around. I'll be putting her e-collar back on her pretty soon after I repatch her. But she went through her surgery well. She came home and she still had meds in her from the vet. I was told to give her more painkillers, anti-inflammatory, in a couple hours in the evening. Well, her pain meds were off before then, and she even got pretty aggressive with me. So I got out my patches and I patched her, which I honestly should have done sooner, and I didn't. So this is what I've been doing for her, and I'm currently still doing. We have, 10 to 14 days of this total until it's all healed up. And I am a certified light therapist, so I'm able to do light therapy on her. I use the blue light on her. It goes into the skin. It helps to heal the skin. It is also cooling, so it helps to cool it down. It helps to calm her. It is antibacterial. The red light goes deeper than the blue. Because they both have different frequencies. It will actually help heal up the muscle that they've had to cut into. It is also antibacterial. It helps with the immune system. I can hold those lights. She's pretty sensitive still, so I need to hold those lights like probably 4 inches away from her incision. The light still gets there. I have also been using the patches on her collar. You can use them together. It's no problem at all. The lights, I have to keep repeating that constantly. The patches I put on her collar, I put them on the collar because then they're not irritating her, wanting her to lick and scratch more. The patches go on her, and they're on for, I've just been leaving them on and then putting new ones back on after 12 hours. Instead of doing the 12 hours on and 12 hours off, which is the norm for these patches. But I like them because they're on her constantly. They are using the light in her body versus me introducing light to her body. So Callie was starting to get aggravated, so I put her collar with her patches back on, and I put her e-collar back on. She was wanting to scratch and lick that incision. She has dissolvable stitches in there, so I don't want her licking it, for sure. But that shows me that using the patches and the lights together versus separately, which I can also do, is healing that faster. I want that 14 days cut closer to 10 days for her to get back to normal. She is a active shepherd. She wants to be out on our farm helping with the horses, doing chores. She likes to play fetch all the time, and she jumps on the couch, etc. I don't want to rip anything out. These patches are very easy to use. I want to show them to you. This patch is actually for collagen. It helps with skin and organs because organs are made of collagen. I currently do not have this patch on her. It is simple. The back peels off like a Band-Aid. It's sticky underneath. The front is clear. And in the center of this patch, right here, is crystallized water, sugar, oxygen, salt, and amino acids. How they work is you put these on your body, or in her case, on her collar. The light from your body comes down to the patch. A frequency is then reflected off of the patch, working with the crystals in it, and sent up to the brain. A signal is sent, that signal is actually then sent to stem cells or cells, depending on which patches you're using, signaling them to get to work and start doing their jobs. That can be, like I said, anything from relaxation, inflammation, pain. It can help with sugar cravings, energy, etc. There are several patches in the family, as I've mentioned, all the things that they can do. There are also 2 patches that work with stem cells. They work with the peptides in your body. The one patch actually helps with anti-aging. If you're anti-aging, you're changing a lot of things. They are resetting genes and helping to reactivate and regenerate stem cells. Our stem cells is what keeps our body healthy. By the time we are 30, we only have half of our stem cells left. They've gone dormant. By the time you're the age that I am, about 60, you pretty much have none left. The other stem cell patch works with bone density and muscle. These are regenerative patches, so they're something that you kind of want to, once you start them, you want to give them at least 3 months to get working. Consider a month per decade old that you are to see changes as far as your stem cells getting back up to the amount of stem cells that you be needing in your body to be healthy. After like my 6 months, you'll see a lot more changes because you've got your stem cells back up to where they need to be. You wouldn't have to stay on these patches, but if you go off, then you're probably going to have your stem cells start going dormant again and your health probably declining again. People wonder about the cost. They average $3.33 a day. That's not too bad for being healthier. So Kelly's relaxing now, pouting, but relaxing. If you'd like to get information about these patches or find out how to get a hold of these patches, you can contact me. I am a brand partner. I've been using them for quite some time. My husband is now using them. I use them on my horses as long as my dogs. You can contact me and find out what patches I did use on Callie, and you can contact me through my profile page. You will find my phone number and my email there. Please contact me. I think you'll be happy with the results and glad you did.